My name is Dr. Yatin Mehta. I am chairman of Medanta Institute of Critical Care and Anesthesiology at Medanta Institute in Gurugram. It's a large tertiary care hospital, 1250 beds, 40 operating rooms, and very high-end, all super specialty work happening here, including liver transplant and heart surgeries. No, patient blood management is, see, whatever you give to the patient what is really required. Empirically, what has been happening in India is any patient with a massive blood requirement or massive bleeding for whatever reason, perioperatively, trauma or whatever, we just pump in whatever we get in that time. That means we pump in the earlier days we used to use whole blood, now people use packed red cells, and then for every packed, so many units of packed red cells, you give so many units of fresh frozen plasma, platelet. It's all empiric. So that is what patient blood management is directed by certain indicators, specific measurements or monitoring which tells you what to use and what is not required. Biggest morbidity indicators and including mortality indicator is the number of blood units transfused. Not only it increases the hospital acquired infection and sepsis, but also the ICU stay, the hospital length of stay and mortality increases according to the number of unnecessary blood transfused. Now, if we can avoid unnecessary transfusions of blood and blood products by certain specific evidence-based criteria, which are based on certain measurements, like for instance the viscoelastic properties of the blood, then you'll be able to appropriately use what is required for the patient and avoid using the products which are not required. And so you reduce the complications of unnecessary blood and blood product transfusions. See, the specific benefits of using a specific indicator of your coagulation cascade is it tells you where the fault lies. Why is the patient bleeding medically, not surgically? Surgical bleed needs to require surgical intervention. But a medical bleed, where coagulopathy is there, the patient is bleeding because of certain either blood coagulation factor deficiency or platelet deficiency or enhanced fibrinolysis happening, then if you can pinpoint by a specific test, point of care testing, which will tell you pretty soon what is wrong with which part of the coagulation cascade, and that is where you specifically hit it with. So if you do that, what the benefit to the patient is, the patient will not get unnecessary blood and blood product transfusions. So not only it reduces the complications of transfusions, which I already mentioned about sepsis and prolonged stay and increased mortality, but also many times the blood products are within the window period of infection, where they may be carrying certain infections which will not be detected by regular blood testing. That means you may be a hepatitis carrier or HIV carrier, which may be within that window period where it will not detect. So obviously there is transmission of serious infections because of blood. Okay, that can be avoided. Secondly, obviously, in particular in private institutions, the people have to arrange for this blood. That means your friends and relatives will have to donate blood. It's a big hassle, particularly for people coming from out of town. How do you arrange for 8 or 10 donors? So that is the problem. Also, the private hospitals, they have to pay for the blood transfusions. There is a processing fee to it. It adds to the cost. Hospital, it reduces your hospital and ICU length of stay. It reduces the financial burden on the patient and subsequently sometimes on either the insurance agencies which do not cover the full spectrum of the thing, or the hospital itself when we have to weigh off the charges. So there is a financial implications to that, and the complications I already talked about. So there are multiple benefits. Benefits to the patient, medically, financially, psychologically, because the stay is reduced by unnecessary transfusions, and also for future happenings. And sometimes the patient, particularly patients with poor renal function who may require, say, kidney transplant in the future. Now, unnecessary blood product transfusions will generate production of certain antibodies which can be harmful to the patient in future also. So that also can be prevented by unnecessary transfusions. See, the first challenge is the thought process of the doctors. Because my hair have turned grey without point of care testing does not mean that what I was doing was right. When I was in training, these facilities were not available. So you have to grow and change your mind thought process, because these modalities were not available earlier, they are available now. So these are specific modalities. GPS was not available earlier. We used to try, bhai sahab, ye gaadi kahan se le jaunga wahan jaane ke liye. Now you look at the GPS. Why? Because the technology is available. So we should use, medicine is driven by technology. And whatever technology is available, if you have the facilities to use them, you should use them. So you should be driven by evidence rather than if you have the facilities, obviously. There is a certain amount of cost involved to all these things. But actually, in practical terms, if you look at the cost saved in avoiding unnecessary transfusions and the morbidity related to that, it easily takes care of that. So cost actually of doing a point of care testing is much less than the actual cost to the patient when unnecessary transfusions are done. Yeah, because that is how PBM is driven. I mean, it has to be evidence based. What do you do it on? Not on your experience or your impression or hunch. It is evidence. There is a graph in front of you which is scientifically proven with enough evidence and enough scientific papers to prove their validity. So you can pinpoint which part of the coagulation system is affected. You are going to only harm the patient if you give products which are not required, and you will benefit the patient if you give products which are required. This all is there in front of you, which we see it every day. So you should, if you have this equipment available of point of care testing for viscoelastic properties, you should use them and you should utilize the evidence for correct patient management.